Hello there. Come along with us for today's Grand Rounds nursing skill demonstration. We will be performing an arterial blood gas draw, also known as an ABG. This procedure involves collecting a small sample of arterial blood, most commonly from the radial artery, but also the brachial artery can be used. This is used to evaluate a patient's acid-base balance, oxygenation, and ventilation status. In simple terms, ABG helps us to determine how effective the lungs are moving oxygen into the bloodstream and removing carbon dioxide. We will first start off by washing our hands, introducing ourselves to the patient, and getting their age, name, and date of birth.
Hi, my name is Kiana and I'll be your nurse for today. We're going to perform an ABG blood draw. Can I get your name and date of birth?
Gabrielle Cage, 02/17/2003.
Okay. Okay. Do you have any allergies?
No.
Perfect.
So we'll be going over the indications for an ABG, which include respiratory failure, chronic obstructive pulmonary disorder exacerbation, suspected metabolic acidosis, and evaluation of oxygen therapy, as well as the contraindications, which include bleeding disorders, peripheral vascular disease, Raynaud's phenomenon, and most importantly, lack of dual artery supply, which we will assess during the Allen's test. Upon conducting the Allen's test, start with the patient's palm facing upward. Note redness of the palm. Next, we are going to occlude both arteries by applying pressure to the radial and ulnar arteries. Note when pressure is applied, there's blanching of the palm. Next, release pressure of the ulnar artery, the pinky side, and assess for blood perfusion. Repeat with the radial artery. Once again, note redness of the patient's palm. Occlude both arteries by applying pressure. Note blanching of the patient's palm. Once pressure is applied, remove pressure of the radial artery, which is the thumb side, and note blood reperfusion. This patient has a positive Allen's test and a candidate for arterial blood draw. Materials that you will need for an arterial blood gas draw include gloves, an arterial blood gas syringe, a gauze pad, an alcohol pad, bandage, a sharps container, and after this, you will start to palpate your radial artery, and then you will start to utilize the alcohol pad and start inner, and then work your way outer for at least 30 seconds. After cleansing the site, you're going to want to insert the needle at a 45-degree angle, noting pulsations of the radial artery as blood fills and collects. And you want to collect up to about 2 to 5 milliliters of blood. Next, you're going to remove it slowly, and that you're going to recap the syringe needle with not your hand, but using the table instead. And make sure that you have a gauze to hold for at least about 5 minutes to watch for any hemorrhaging and bleeding. You also want to make sure that there is a bandage over the puncture site. Some general tips or things to know when doing this is that you do not want to use a tourniquet because this can lead to an excessive risk of bleeding, also a hematoma, or even a thrombus or an embolism. You also want to make sure that whenever you push up the needle to inject any air bubbles. And also, after that, you want to make sure that you really focus on the importance of making sure the patient's full name, medical ID, number, and date of birth is on the lab specimen, as the nurse labels the date, time, and your signature to prevent any delaying of care. Errors. Next, place the ABG draw over ice and contact transport to deliver the specimen to the lab. You are going to place the needle into the sharps container and perform one more time of hand hygiene. And that will conclude our grand round nursing skill, which was an arterial blood gas draw.